So I'm here with Dr. Ajay Kumar T. He's a famous orthopedic surgeon from India. He works in Apollo Hospital in Angamali, which is close to Cochin. And glad to have Ajay with us for our discussion. So I know him for a long time. We both went to the same school. We both went to the same medical school in India. And initially, we both started training in orthopedic, and he worked in India, and I moved on to US and went through physical medicine rehabilitation training and pain medicine fellowship. We just discussed many things, and we're trying to figure out how treatment and treatment options are available, and what difference are there between the two countries, India and US, which are both following similar system of medication and treatment. So we'll just start with what is the orthopedic treatment gap, and I'll just pass on the mic to him.
There's a lot of treatment gap in orthopedics, as you said rightly. So, for example, a patient coming to you, a 40-year-old patient coming to you with knee pain, what are the treatment options? From our studies, we classify it into traumatic, inflammatory, neoplastic, degenerative.
Yeah.
At the age of 40, if a patient is not having any history of trauma, it could probably be in a degenerative category.
Yeah, definitely. That's the most common.
The most common thing.
Yeah.
Inflammatory things we can handle with anti-inflammatory medicines and all.
Sure.
But the degenerative thing, what are the treatment options?
So to piggyback on that, when I went to med school late 90s, and even then, what people used to get is a cortisone injection or a steroid injection to help with inflammation, and then maybe come back another few months later, get another cortisone injection, and then finally the doctor would say, oh, you don't have a whole lot else to offer. Now when you're ready for surgery, come back to me. And we see the same situation here now. After almost 25 years, a lot of things have progressed in so many years, but it's sad to say that for the majority of the folks, that is still the practice. Even here, it just that there is that gel injection, but again, that don't have any spectacular outcome. It just maybe could help you months for some people, but for the mainstream of people, and also mainstream under insurance coverage, it's just that you have cortisone injection after which we all know that it only works for such a short time frame, and it is bad for the cartilage, and unfortunately that is still the mainstream of treatment here too.
Yes. Interesting part is as soon as the Google people started searching over the internet for the various treatment options, they are scared of steroids, because steroids, as we all know, have a lot of side effects.
Yeah.
Especially when you give it. The second time when you are giving, it is less effective.
Yeah. So there is a big switch in the perception of the public, and at this point, people are waking up to the reality that repeat cortisone injection. By the way, people get cortisone injection for almost everything. And we see podiatry, like going to any or even pain management in the mainstream is still cortisone injection, and you're not the only doctor that's treating the patient. Patient comes to you and you're seeing the patient after 3-4 months, but in that 3-4 months, they've got another cortisone injection from a podiatrist and another cortisone injection from a different specialist, and had like a steroid, big course of steroid for a respiratory flare-up and all that. So it all adds up. These are all, technically small doses, but they all add up and lead to weight gain, poor health, osteoporosis, and lead to much bigger problems. So. And also, people are waking up to the newer possibility of regenerative medicine, which is quite interesting, and it's a promising field. There are more and more studies which show that injecting PRP or bone marrow concentrate, which has stem cells into the joint and also into the inflamed area within the bone, that's bone marrow lesion, can give many years of good sustained relief before going into replacement. So again, just to recap for all the people who are listening, the treatment gap is the gap from having the first cortisone injection or having the initial diagnosis until we have the knee replacement. And there's not a whole lot of good treatment options. There is physical therapy, there is some cortisone injection, maybe a gel injection. But one of the things that always surprised me is that when I went to med school and training back in nearly 2.5 decades ago, we did cortisone injection for a knee arthritis or a wear and tear arthritis of the knee, that is osteoarthritis. And then there was not a whole lot. The next stop is knee replacement. We do have physical therapy, a little bit of glucosamine tablets and some gel injection, but none of them really made a big difference. So we always find patients surprised and frustrated that they went to the doctor, they were told that, okay, come back when you're ready for surgery. There's a big gap from the initial diagnosis to what can be offered. So I was just wondering, is it still the same in India, or how things have changed?
In fact, a patient coming at around 40 years of age with knee pain, the causes most probably, if there is no history of trauma, can be a degenerative process setting on that patient.
Okay.
But this degenerative process, we have nothing much to offer at this moment.
Okay.
And we usually give anti-inflammatory medicines, physiotherapy, and prolong the situation and offer a joint replacement for the patient.
Sure, yeah.
Currently, the system is changing. We have started taking more and more MRIs for the diagnosis.
Okay.
So that have changed the perspective.
Okay.
So when you take an MRI, you know about the ligaments, tendons, and cartilage, meniscus, all those things.
Okay.
And we know that it is not the time for joint replacement at this moment.
Okay.
Then we have started giving PRP, autologous conditioned plasma and all.
Okay.
But the regenerative therapy, as you practice, has not picked up well in India.
Okay. So here, we are a Regenix affiliate, and Regenix is a leader in the regenerative medicine world. So we have few options to help with patients who are not really a surgical candidate, but at the same time, we could give them symptomatic relief and slow down the wear and tear for knee arthritis or a ligament injury or a tendon change like tendinosis or partial tears in the tendon by PRP or bone marrow concentrate, which has stem cells, or soft wave, which is again a regenerative therapy mode. So these treatment options we are able to control the symptoms and give more years before they need a replacement.
When I visited your clinic, I was curious about knowing more about the soft wave.
Okay.
Could you tell me more about that?
Sure. So we have the most advanced version of shockwave therapy, and it's the same technology like extracorporeal shockwave lithotripsy, that is using shockwave to break the kidney stones. So when people did that in people have been doing it since 1970s and 80s, and they found that they break the kidney stone, and if you have a incidental damage to the disc or joint, that also helped them. So they've been developing machines over the last couple of decades, and now we have the latest one, which is SoftWave, which gives almost immediate relief in about 10-15 minutes, needles, and it also promotes cellular level healing and improve vascularity. So that's a good adjuvant tool, and we can combine it with PRP, or we can use it as a freestanding therapy. And that the good thing is that it gives immediate relief for a lot of people with acute flare-up of arthritis or a sports injury, like you tore your hamstring. You can do that, and you're coming in limping and then walking out good. So that's a pretty satisfying treatment.
And moreover, there is no much side effects.
Yeah, very minimal or hardly any side effects in that. So the third thing that we want to discuss is treatment of low back pain. Low back pain is still probably the most common orthopedic condition here and also back in India. So how have things changed in treatment of back pain?
Yeah, back pain, usually we give physiotherapy, anti-inflammatory medicine, posture changes, and surgery is reserved for only a few set of patients who don't improve with all those things.
Okay.
But I think a lot of things have changed in the rehabilitation medicine
Sure.
or in the treatment of backache. Could you explain on that?
Sure. I think the biggest change in how orthopedic medicine is practiced across the two countries is that we do way more surgeries than in India for degenerative conditions like a slip disc or sciatic nerve pain. And we all know that surgery can be helpful in some situations, but a lot of the situations can be saved without surgery by doing, again, regenerative medicine, including PRP, stem cells, and physical therapy, strengthening muscle, and soft tissue therapy to bring pain relief and regeneration of tissue. So that's a big changing field, and there is a lot of options in regenerative medicine treatment.
You have to look at, from the treatment perspective, you have to look at the bigger picture and examine the patient, take a good history, and select. Each individual is different.
Individualized treatment is
required, and more and more personalized medicine.
So I think that's the same. And I think
precision medicine.
Precision medicine. That's the same over the last 2.5 decades. Again, the best thing for the patient is, again, a detailed history and examination. That is the number one treatment option. That gives a proper diagnosis, then we can treat it.
Thank you, Mahesh. It has been a very wonderful experience visiting you after a long time. We have been
we still discuss whenever we have a question, we still discuss. It's good to have.
But seeing you personally in this space gives me more pleasure because we have grown in the same field during childhood days, and even in the college we have been together. It's very nice meeting you.
Thank you.
Thank you.